Hi, my name is Caitlin, and I'm a C. diff survivor. I never thought that I would ever say those words. I have been a nurse and worked in healthcare for 15 years, and I have taken care of several patients who had contracted C. diff, and I had seen their suffering very close and personally, and I've always been really careful, and so I never thought that this would happen to me. I'm 36 years old. I was 35 when I was diagnosed, and my journey is not unique. A lot of people think that this is a condition that affects older people, and it doesn't. It affects younger people just like me. I had been treated for a different infection that turns out I actually did not need antibiotics for at all, but unfortunately, the physician that I dealt with felt that that was the course of treatment that was needed, and so I took 10 days worth of antibiotics, and I started having GI issues after that. I saw my primary care provider, I think, 6 times prior to having a diagnosis because it never occurred to them that I could be a patient that had C. diff. I am not older. I am not immunocompromised. I had just had 1 round of antibiotics in a very long time. I did not meet their requirements for testing based off of the knowledge that they had. Looking back at the situation, I absolutely did. Anytime that anyone has diarrhea more than 3 times a day for more than 3 days in a row, that always warrants testing. And so anyway, I was diagnosed and I was given Difficid, which is an antibiotic that's supposed to take care of C. diff, and unfortunately it did not work. And I was very, very lucky to have a local GI physician who had treated several C. diff patients in the course of her career, and she believed strongly that FMT would take care of the C. diff infection and I should be able to return to life as I did before. And so I had my first FMT in September of 2024. And unfortunately, it was not successful. And so it was repeated again about 2 weeks later, and that one was also not successful. And at this point in time, my doctors were a little bit puzzled because, again, I'm young, I'm relatively healthy, I had followed the protocol exactly as I should for medication, and they just said, well, maybe you're just a little bit unlucky. And so we attempted a third time. And after the third time, I had a few weeks where I didn't have any symptoms, and I was really, really hopeful. And 2 days after Thanksgiving, the symptoms came back very quickly, and I knew instantly that the infection was back. I was admitted to my local hospital, and I had a very hard conversation with my doctor. They basically told me that I had used the resources that they had because Open Biome, due to regulatory issues, was no longer going to be able to distribute the stool donations for FMT, and that they were unsure of why this infection was holding on. And so their recommendation was that I go to a higher level of care. And during this conversation, we did discuss what would happen if this didn't work. And it was a conversation I did not think I would have at 35 years old. I did not think I would be discussing my own mortality with a doctor who very much cared for me and my well-being, and they knew that I was a mother of 3 and married and a daughter and a friend and someone who dedicated their life to taking care of other people. They didn't know what to do. And so they referred me to Dr. Monica Fisher, and she repeated the FMT, and I also received VOWST at the same time. And she was incredible. She has been doing this for several years. She's had several patients who have needed multiple FMTs, and her patients get better. Sometimes it does take a while. And she also had the same conversation with me, like, I have this resource for you right now, but this resource is going away. And so we're going to hope for the best, and we'll do everything that we can for you, but I can't guarantee what will happen if you need another one down the road. And so I had the procedure, and I was doing better overall. Unfortunately, it was the patient that developed the post-infectious IBS. So I was having some pretty debilitating GI symptoms, which can make it really hard to differentiate between a true C. diff infection or not. And then I got really, really lucky and was accepted into Mayo Clinic C. diff clinic. And I met Dr. Sahil Khanna, and he's just an incredible human being. He is the first physician he really saw me as a person and a professional, and he helped me figure out what the best course moving forward was for me. And I'm very grateful for that, because sometimes the healthcare is rushed. There's too many patients, not enough doctors, and too many people that need so many things. And anyway, I was able to receive a fifth and final FMT from their stool bank. They did an upper and lower delivery, and I have been C. diff free since. But the journey didn't just end there. It took me 8 months to be able to eat and drink normally. I lost 68 pounds in the course of 10 months. I am still dealing with low vitamin levels. I am still dealing with not getting adequate calories. I'm still very tired. And the emotional side of it is every time I have an upset stomach, I am afraid. And I'm afraid because I know how serious this is. And I'm also afraid because the treatment that saves lives was taken away. And I'm glad that Rebiota is FDA approved. And I am glad that Vowst is helpful for some patients, but it is not helpful for all patients. It would not have saved my life. And it is also not approved for children. And that is another component of my story. I am married and I have 3 children. And so I had to make sure that my house was completely sterilized and I had to keep myself away from my family to prevent them from getting this infection. And that was really hard. And my kids watched their mom become incredibly ill. And my hope and prayer for our future is that all physicians know the standard of treatment for all infections. They pick the most appropriate course of antibiotics only when absolutely necessary, that they reserve the broad spectrum antibiotics only for when it is absolutely necessary and there are no other choices. My hope is that they understand that not all patients are in a long-term nursing facility, that most patients these days are actually not in the elderly population. There's a significant number of patients who are young. You can even get C. diff without having an antibiotic. I think Mayo Clinic said something around 30% of their patients, they don't know the exact cause, but this bacteria is in our everyday lives. It's on every surface in a hospital, a doctor's office, a clinic, public restrooms. Sometimes even going out to eat can be a risk because you have to trust that those people are washing their hands and having safe hygiene practices. And then, of course, anytime you are on an antibiotic, you are exponentially at risk for this. And this includes young adults, teenagers, children, the elderly population. It doesn't matter. Everybody has this risk. And my hope is that by sharing my story, it will do 2 things. One, it will show people who are on this journey that they can live, and they will if they have the resources they need. And the other thing is just to show that this is not uncommon. It is not rare, and we need help. We need help to protect patients. This is the most common hospital-acquired infection in the United States. It is responsible for more deaths than drunk driving incidents in the United States. It is an undignified and horrible way to be sick and die. I could not be touched by anybody. They were in a gown and gloves, and even then I felt like I was a risk to them. I didn't want my nurses to come in and do anything for me because I didn't want them to be on the receiving end of this. I told my husband, I was like, don't come and see me because I could not risk him bringing this home to our family. I could not risk another person's life being in jeopardy. And there are things we can do. And so if you are a C. diff patient, stay in the fight because it is worth it. I promise it is worth it. If you are healing from this journey, know that your mind, your soul, and your body, it takes a lot of time, and it's okay to be scared, and it's okay to lean on friends and family. And I'm very, very grateful for the Peggy Lillis Foundation. It gave me a place where I could speak to other people that had walked on this path. It gave me hope. It gave me a sense of purpose again. And I am so grateful for their dedication to everyone's health and well-being. Thank you so much for your time.